Cancer. The very word evokes fear, uncertainty, and a profound sense of vulnerability. This formidable foe casts a long shadow across the globe, touching countless lives with its devastating impact. It is a disease that knows no boundaries, affecting individuals of all ages, races, and socioeconomic backgrounds. Cancer is a leading cause of death worldwide, accounting for millions of fatalities each year. Its reach extends to every corner of the planet, leaving a trail of human suffering in its wake. The financial strain of cancer treatment, coupled with the loss of productivity, places a significant toll on individuals, families, and healthcare systems around the world. Moreover, the emotional and psychological impact of cancer can be profound, affecting the well-being of patients, caregivers, and entire communities. Despite the challenges posed by cancer, there is hope on the horizon. Advances in medical research continue to unravel the complexities of this disease, leading to new and innovative treatment approaches. To truly comprehend the elusive nature of a universal cancer cure, one must first delve into the fundamental mechanisms that drive this disease. At its core, cancer is a disease of the cells, the very building blocks of life. Our bodies are composed of trillions of cells, each programmed to perform specific functions and work harmoniously to maintain our health. However, this intricate cellular orchestra can sometimes go awry. Cancer arises when cells within our bodies break free from their normal regulatory constraints and embark on a path of uncontrolled growth and proliferation. This cellular rebellion is often triggered by mutations or errors in the DNA that govern cell behavior. These mutations can be inherited from our parents or acquired throughout our lifetime due to environmental exposures such as tobacco smoke, radiation, or certain chemicals. When these genetic alterations occur in critical genes involved in cell growth, division, and repair, they can disrupt the delicate balance that keeps cell proliferation in check. Cancer is not a single disease, but rather a complex and heterogeneous group of diseases, each with its unique characteristics, behaviors, and treatment challenges. There are over 100 different types of cancer, classified according to the type of cell or tissue from which they originate. Some of the most common types of cancer include lung cancer, breast cancer, colorectal cancer, prostate cancer, and skin cancer. However, within each of these broad categories there exists a wide spectrum of subtypes, each with its distinct molecular profile, clinical presentation, and response to therapy. This inherent diversity of cancer stems from the vast array of genetic and epigenetic alterations that can contribute to its development. Each cancer cell is a product of its unique mutational landscape, which influences its growth rate, invasiveness, and susceptibility to different treatment modalities. This ongoing evolution poses a significant challenge to treatment, as cancer cells can develop resistance to therapies that were once effective. The advent of genomic technologies has revolutionized our understanding of cancer, providing unprecedented insights into the genetic underpinnings of this complex disease. By deciphering the DNA sequence of cancer cells, scientists can identify the specific mutations that drive their uncontrolled growth and survival. This knowledge has paved the way for the development of targeted therapies, drugs designed to specifically target cancer cells based on their unique molecular signatures. Unlike traditional chemotherapy, which attacks all rapidly dividing cells, including healthy ones, targeted therapies aim to selectively kill cancer cells while sparing normal tissues. While targeted therapies have shown remarkable success in treating certain types of cancer, they are not without their limitations. Cancer cells are notoriously adept at evolving resistance to these drugs, often through the acquisition of new mutations that bypass the drug's mechanism of action. Section 5. Environmental triggers, lifestyle and cancer risk. While genetics plays an undeniable role in cancer predisposition, it's crucial to recognize that environmental factors also exert a significant influence on cancer risk. Lifestyle choices in particular can have a profound impact on our chances of developing this disease. Tobacco use is one of the most well-established environmental risk factors for cancer, accounting for a significant proportion of lung cancer cases worldwide. Other lifestyle factors that have been linked to an increased cancer risk include alcohol consumption, a diet high in processed meats and red meat, obesity, and lack of physical activity. Exposure to certain environmental carcinogens such as asbestos, radon, and ultraviolet (UV) radiation can also contribute to cancer development. The good news is that many of these environmental risk factors are modifiable, meaning that we have the power to reduce our cancer risk through lifestyle changes. Section 6. The quest for a cure. Challenges in cancer treatment. The pursuit of a universal cancer cure has captivated the minds of scientists and clinicians for decades. However, the complexities of this disease have made this quest an arduous and often frustrating one. One of the primary reasons why a single cure for cancer remains elusive is the sheer diversity of this disease. As we have discussed, cancer is not a single entity but rather a collection of over 100 distinct diseases, each with its unique molecular profile, clinical behavior, and response to therapy. This heterogeneity makes it highly unlikely that a single drug or treatment approach will be effective against all types of cancer. Another major challenge in cancer treatment is the development of drug resistance. Cancer cells are highly adaptable and can evolve mechanisms to evade the effects of even the most potent therapies. This acquired resistance is a major obstacle to achieving long-term remission and cure. Section 7. Precision medicine. Tailoring treatments to the individual. In recent years, the field of oncology has witnessed a paradigm shift towards precision medicine, an approach that tailors treatment to the individual patient based on their unique genetic makeup and the molecular characteristics of their tumor. This personalized approach to cancer treatment is based on the understanding that not all cancers are created equal. By identifying the specific molecular drivers of a patient's tumor, clinicians can select therapies that are most likely to be effective against those targets, increasing the chances of success while minimizing side effects. The foundation of precision medicine lies in genomic profiling, which involves analyzing the DNA of a patient's tumor to identify mutations that may be driving its growth. This information can then be used to guide treatment decisions, such as selecting targeted therapies that are designed to block the activity of specific mutated proteins. Immunotherapy represents a groundbreaking approach to cancer treatment that harnesses the power of the body's own immune system to fight cancer. Unlike traditional therapies that directly target cancer cells, immunotherapy works by stimulating the immune system to recognize and destroy cancer cells more effectively. One promising avenue of immunotherapy involves the use of checkpoint inhibitors, drugs that block the activity of proteins that normally keep the immune system in check. By inhibiting these checkpoints, these drugs unleash the immune system's full potential to attack cancer cells. Another approach involves engineering a patient's own immune cells, such as T cells, to recognize and target cancer cells more effectively. This personalized form of immunotherapy, known as CAR T-cell therapy, has shown remarkable promise in treating certain types of leukemia and lymphoma. While immunotherapy holds immense promise for the future of cancer treatment, it is not without its challenges. Early detection plays a crucial role in improving cancer outcomes. When cancer is detected at an early stage, when it is still small and localized, the chances of successful treatment are significantly higher. Cancer screening tests are designed to detect cancer in its early stages, before symptoms appear. These tests can help identify individuals who may have cancer but are not yet experiencing any symptoms, allowing for earlier diagnosis and treatment. Common cancer screening tests include mammograms for breast cancer. Common cancer screening tests include colonoscopies for colorectal cancer. Common cancer screening tests include Pap tests for cervical cancer. Common cancer screening tests include prostate-specific antigen, PSA tests for prostate cancer. In addition to screening, cancer prevention strategies are essential for reducing the overall burden of this disease. The field of cancer research is constantly evolving with new discoveries and technological advancements emerging all the time. These breakthroughs offer hope for more effective, less toxic, and more personalized cancer treatments in the future. Nanotechnology, for example, is being explored as a way to deliver drugs directly to cancer cells, minimizing damage to healthy tissues. Artificial intelligence, AI, is being used to analyze vast amounts of data to identify new drug targets and predict patient response to therapy. CRISPR-Cas9 gene editing technology holds promise for correcting cancer-causing mutations directly within cells. The future of cancer therapy lies in a multidisciplinary approach that integrates these emerging technologies with our growing understanding of cancer biology. The quest to conquer cancer is a journey of hope, driven by the relentless pursuit of scientific knowledge, technological innovation, and unwavering compassion for those affected by this disease. While a universal cure may remain elusive for now, we are making remarkable progress in our understanding and treatment of cancer. Through continued research, technological advancements, and a commitment to early detection and prevention, we are moving closer to a future where cancer is no longer a death sentence but rather a manageable chronic disease. The journey may be long and challenging, but the destination is one worth striving for, a world free from the shadow of cancer.